Well, yeah, hold on. Okay, well, not yet, not yet. Let's wait for Delegate
I can't go
Hutchinson to
back
get
and
back
see it.
on. All right, let's wait for Delegate Hutchinson to be back on, and that'll give a couple other members some time to get here. And let's go ahead and text. Okay, good. Delegate Warman's here. Delegate Riley's here. Perfect timing. Sort of like when you want the train to come, you light a cigarette. All right, good. Delegate Warman. All right, let's go ahead and go live then. Okay, good afternoon. This is the Public Health and Minority Health Disparities Subcommittee. I'm Delegate and Chair Terry Hill, and it is March 6, 2026. We have several bills, and I first apologize that we had a voting session, so we're starting about 50 minutes late, but we're going to try and move the discussion on the bills in any case. So the first bill we'll take up is 410, then HB 1004. Um, then actually, I'm going to go slightly different order. We're going to then for number 3, we'll take up 1357. Then we'll take up 1485. We'll take up 1523. And then the last bill will be 1264. Okay. All right. So let us start with 410. Chris, can you tell us about that bill? Well, we'll hold up 1 second until our council comes back on.
Sorry.
It's okay. It's all right.
All right. I got some law books here. Let me prop myself up.
There you go.
Okay. Can you see me? Okay, here we go.
Looking good.
Okay. Which one are we on? Let's see, 410.
410.
Okay. This bill establishes new requirements regarding labeling of food items and milk products for human consumption and prohibits the sale of items labeled with the sell-by date that do not meet such requirements. Beginning July 1st, 27, a food manufacturer, processor, or retailer must use specified phrasing to indicate quality date or safety date. The bill's food labeling provisions do not apply to infant formula or beer or other malt beverages. By July 1st, 2027, MDH must create and post on the department's website educational materials to inform consumers about the meaning of quality and safety dates and adopt regulations to carry out the section. We did receive an amendment from Delegate Boyce's office. The amendments strike milk products from the bill. It also includes for the educational component that the department work in conjunction with the University of Maryland Extension and food donation organizations. Second. It also authorizes food retailers to sell, offer for sale a food item manufactured for human consumption that isn't labeled in accordance with this section if the food retailer purchased the food item on or before June 30th, 2028.
Okay.
And
All
those are,
right. Any more? And that's it?
yeah.
Okay. Delegate Boyce, can you tell us if the amendments um, bring about the unity that we so desire and affect and bring down the fiscal note of 125K?
Good afternoon, Madam Chair. Meredith Riley from Delegate Boyce's office here. I want to recap the amendments because there are a couple things that weren't mentioned at first, captured in our latest round of amendments. So we've got the MDH and UMD Extension and food bank organizations working together on educational materials. We also pushed the timeline out to 2028 and included a sell-through for the retailers to hopefully get at their concerns. That's page 4, line E3, I think. We also put in a provision about federally regulated food items, that this bill would not apply to any federally regulated food items. trying to get at the Consumer Health Products Association's concerns that you heard in committee testimony. And like Chris said, we are removing milk and eggs from the bill. I and Delegate Boyce are hopeful that these amendments are comprehensive and get to the concerns of all of the stakeholders here. We've been meeting with Giant Foods, we've been meeting with MDH, we've been meeting with the retailers. We really want to see a path forward here, and we're really hopeful that these amendments create that.
Okay, so if I understand Meredith, you're hopeful, but you haven't got confirmation that they're okay with everything. Is that correct?
I think we're at the point where these amendments have been shared, and I think there is, how would I say it? I think there is still some concerns from some groups, but I think Delegate Boyce is not sure what else
Okay,
would satisfy them, I guess.
okay. And so you're, okay, let's see. Are there any representatives from the retailers here? I don't see anybody. All right, so I think that your question is, does the subcommittee wish to move the bill with the work that's been done? Or does the subcommittee feel like the bill's not ready and it comes back another year? So it's, any questions? Can we have a motion on the amendments so we can have that discussion?
Move the amendments.
Second.
Okay, all right, so discussion on the amendments. Any questions about the amendments? Okay. Delegate Riley.
Yeah, with the amendments, I'm just not so sure that it satisfies my concerns that I had with the ones brought up by the Maryland Retailers Association. So
What were your concerns that,
Yeah,
which of their concerns, Delegate Riley, are you concerned about specifically?
well, they talked about how it would be a significant financial burden to small businesses, and that's a real concern to me. I don't know with the amendment if that changes that aspect to it. And also requiring them to conduct, this is a big one, a laboratory test to establish that date that would ensure the product would be safe for consumption. So that's a real concern.
Okay,
And
Meredith, can you address those two questions and tell us if those are still aspects of the bill?
Yeah, absolutely. So the first concern when it comes to small businesses, the sell-through that we put into the bill, that's on page 4. What that
I'm sorry, is that
line,
on the amendment page?
yes,
Or, okay,
correct,
gotcha, all right.
correct. There's a line of text that says, let me pull it up and read the exact line. Sell or offer for sale a food item manufactured for human consumption that is not labeled in accordance with this section if the food retailer purchased the food item on or before June 30th, 2028. And so this would allow any retailer who had purchased a food item that wasn't aligned with the bill, they have until June 30th, 2028 to sell all of those items out of their inventory. We don't want to see, the point of the bill is to get away from wasted food. So we don't want to create more of that. And this sell through would allow any retailer, big or small, to sell out their inventory that they already have with the past labels before they have to bring in new inventory with the new labels in 2028.
So you're saying that was the cost that the businesses were concerned about, and that's how you addressed it?
Yes, that was a concern from the retailers, and that's what we worked in with them.
Okay, so this amendment, this portion that you just spoke about, that was their amendment?
Yeah, we worked with Kaylee on that.
Okay,
Okay.
all right, and the second one?
question?
The second question, where is the line that you're reading about the laboratory testing?
I think it was in, I don't know, not sure it was the retailers, but someone else in the industry said that, I see somebody, I don't know if that was the gentleman or not, said something that this would create really difficulty in the laboratory testing by changing this sell date, because they would have to keep, I guess, keep testing it or something.
Yeah, and I don't think, and I will tell
That's,
you,
sorry,
Yeah, let me interrupt for a second, Meredith. You can correct me. I don't think, in other words, Delegate Riley, right now they come up with best if used by dates and all those things. That's not necessarily from testing. That's just already, like on prescriptions, it's a year after you sell it. So there are already formulas for how to do that. So I'm not sure that
That would be an issue. Okay.
that's an issue, but we
I
can.
just, I captured
Meredith, did
it
you have
during
anything
the.
else to add to that? And then we'll listen to, who else had his hand up? He just disappeared. No, Mr. McLucky.
Yeah.
Yeah, I would just add really quickly, that's not an issue that we've been approached about
Okay.
unless it applies to the Consumer Health Products Association. They have or they had concerns about federally regulated food items like dietary supplements. So maybe that's where that
And
comes
you took
in, but
that out,
that's
correct? And you took that out?
correct. We're exempting
Okay.
federally regulated food
Okay,
items.
Mr. McLucky?
Yes, thank you, Madam Chair. And I do want to speak to the exemption for federally regulated food. We did request a very, very narrow exemption for dietary supplements. All food is federally regulated, either by the USDA or FDA. So therefore, if there is now a provision in this bill, an exemption for all federally regulated food, would that not exempt all food from the bill? And then therefore, what would the bill then do? Is my question. We did ask for a very narrow exemption, and now we're going to be exempting all federally regulated food. So therefore, would that not be all food?
Okay.
If I could respond,
Yes,
Madam
please.
Chair, we didn't receive the specific narrowly tailored amendment language from them until 10 minutes before 1. So
That was
we did not get a
submitted
chance.
in our
Okay,
testimony
so
prior to the committee
wait,
hearing.
stop. Okay. So we've moved the amendments. What is the, let's go ahead and, I mean, I'm concerned it doesn't sound like everything's quite ready. So, Delegate Hutchinson.
Yeah, I was just about to say the same thing. I share that same thoughts, Madam Chair. Just there's still a lot of moving parts here. I don't think it's ready.
Okay. With that, do you all, we moved the amendments, shall we take a vote on the amendments? Let's take a vote on the amendments that are before us, that Delegate Boyce's team thinks are the right amendments. There's some concern that was just offered that that it may actually cause more problems, or does the person who made the motion to move the amendments, want to withdraw their motion at this time?
Before I do that, is the intent to hold the bill so that we can further discuss?
Is that what you would like as the maker?
I would prefer that. I like consensus if we can. So I'll withdraw my amendment so that we can hold the bill.
Okay, so Tuesday, okay? We'll put it on for Tuesday.
Thank you, Madam Chair.
Okay. And I suspect that if we can't move it on Tuesday, it's a strong indication it's not ready for the session.
Thank you, Madam Chair. I appreciate the feedback.
Thank you. Okay, let's go on now to HB 1004, prohibited ingredients in food, Delegate Austin. And so, Chris, can you tell us about this bill?
Thank you. Thank you, Madam Chair.
Thank you, Madam Chair. This bill prohibits a person from manufacturing, selling, delivering, holding, or offering for sale food that contains a list of substances and any other ingredient or additive that is prohibited for use in food under regulations adopted by the FDA or any other federal law or regulation. Violations are subject to existing criminal and civil penalties. There was an amendment sent by Delegate Austin that list that I did not actually say out was because I chose not to say it because the amendment strikes that list and just leaves any ingredient or additive that's prohibited by the FDA.
Delegate Austin, can you explain?
Yes. So currently the FDA is reviewing several ingredients to be banned, amongst them the red dye, which is one of the ingredients that this bill's become known for in the different states that it's been passed in. I think with the amendment, it actually makes the bill stronger because it will include all of the ingredients that have been banned by FDA. It will also I'm sorry, it will also not require an update every year to the state statute or every month as FDA continues to work through the list of banned ingredients. I had a conceptual amendment that I wanted to do to create a review process to, in the event that the FDA takes these ingredients and puts them off the ban list. But I think for the sake of this session, that this bill is ready. We have consensus on this amendment, and I would like to move the bill.
We'll move
As
the
amendment.
amendment.
Move the amendments.
Okay. Mr. McLucky?
Madam Chair.
You're fine with the amendments? You're at least neutral, if not in support
ma'am.
now?
Yes,
Okay.
yes, Madam Chair. Thank you.
All right, anyone else to speak to that? Okay, so the amendments have been moved and seconded. All in favor of the amendment, signify by saying aye or raising your hand, virtually or in yellow. Okay, so I've got Riley's yes, Hutchinson's yes, Martinez, Austin, Delegate Kaufman, are you a yes?
Yes, I
Okay.
was eating an apple, but I'm a
Okay.
yes.
All right, thank you. And Delegate Warman and me. So that's unanimous on the amendments. Can we get a motion on the bill as amended?
Move the
So-
bill.
Thank you,
Second.
Second.
Kaufman. So, all right, and let's vote again. All in favor, raise your hand and or signify by
Wait a
saying
minute.
aye.
Wait a minute.
Aye.
I'm sorry, Madam Chair. I do have a
Yes, I'm
question.
sorry.
before we
My
vote.
apologies. My
That's
apologies.
okay.
There should be discussion. Go ahead, Delegate Riley.
Yes, discussion.
Okay.
So as the bill currently sits with the amendment, if any changes within the FDA comes down, is there still an option for a legislator to put in a bill to change it, to either add it back on? Now, I guess if they take one off, then ours automatically comes off, correct?
And that is the part where it was a little tricky, right? Because if
Yeah.
it's banned. I would say based on the way it's drafted,
Right.
anything that's banned at the federal level would be banned at the state level.
Okay, so that's automatic.
That part's
So-
automatic.
Okay. So would there be a possibility if a legislator wanted to change that? Is that still an option?
Delegate Austin, can I ask council to weigh in?
Okay, I see.
Thank you. Chris?
Thank you, Madam Chair. Delegate Riley, I hope this answers your question. So we would be tied to the FDA with whatever the federal government decides to do in regards to banning these additives. But any member of the assembly could add to the list, just like there was a list before the amendment.
Mhm.
Someone can go in and add something else to the list that the FDA currently isn't banning. Does that answer your question?
Yeah, so once it's banned, it's banned. And we don't have the option to go back and reevaluate that.
Right, so we can't unban it,
Can't
but
unban it.
if the bans at the federal level go away, then we
Right.
have
Right.
state bans that would stand.
Okay, so if the federal government takes something off the list,
Correct.
we have the option to go and correct that and take it off
It
of our
stays on the list.
legislation?
Correct. No,
Okay.
Chris, I'm sorry, Chris, go
That-
ahead.
Is that true?
Under this bill, we're tied to the federal government. So whatever the federal government decides, whether they add a substance or ban one, it would happen for Maryland as well. as
Okay,
a
so it goes
federal
both
government.
ways.
Yes,
They're the leader and it goes both ways with this bill.
yes.
And isn't that true anyway, Delegate Austin, that if the feds ban it, that we can't have it?
Correct.
Okay.
And so what does this bill accomplish?
So what we need to do is really say, once it's banned at the federal government, it's forever banned here, because the problem is what happens if they put it back on the list. What the bill was supposed to accomplish was banning ingredients that the federal government had not yet banned. And what it's supposed to do is make sure that once these ingredients are banned, that they can't come back on unless we as a state decide to bring them back.
But
And I
that,
think that's the missing piece, but because we reached a consensus, I believe that next year we can add that piece to it. I know that I had a theoretical understanding with Ms. Locklear, but I don't want to proffer language that I haven't discussed with her, and I don't want to hold the bill up either.
well, so let me ask the question, how is the bill, if we pass the bill, how's that different from the current status? What does it change?
I think that it would be open to interpretation whether or not you can, once they're banned, they're always banned. I don't know that the bill language is crystal clear on that. I think it's a ban. And so then someone would have to argue, oh, it's off the list, so it's no longer banned.
So are you saying that your understanding of what this bill does is it will require an affirmative action of the General Assembly to lift it if it went away at the federal level? And Chris is saying no. Chris, tell us what this bill does as compared, as written with the amendment. What are we accomplishing with this bill?
As is written, I guess, as is written, what it really does is allows the department and the state in general to enforce the bans along with the FDA. Again, though, if something is banned at the federal level and this bill is in place as law, it would be banned in Maryland. If they decided to unban something, it would be unbanned in Maryland, as long as no other legislation is passed to ban that substance.
Okay, and before I go to Delegate Martinez, so how is that different from current situation?
Which is why I said we needed an additional amendment, because the intent is for it to forever be banned. What I would say is that it doesn't explicitly say that it comes back on. Like the language doesn't say it comes back on. So it would be subject to a judge's interpretation. So a judge could say, well, this was banned after this bill was enacted in 2025. All of these things were banned. And then in 2030, it comes back on. It would be up to a judge to say, no, it's still banned because we never proactively unbanned it. That would be, and maybe some judge, some law clerk will listen to this debate and determine our legislative intent. So let me say it right now. The intent is once they ban it at the federal level, for it to stay banned here in Maryland unless we proactively do something. But I understand how these things work. And I think that that is a part of the puzzle. I'm happy to hear from my colleague, Delegate Martinez.
Delegate Martinez, please.
Thank you, Madam Chair. Just for clarity, so what we're doing with this bill as amended is saying, okay, the feds have banned red dyes, right, in certain categories, and we're going to codify that we are matching their banned list. But let's say something happens, because things always do, and they say, okay, now this is legal at the federal level. What I'm understanding, though, there isn't anything in the bill that explicitly says now it's also legal here in Maryland. So that is the piece where I'm saying I think we can still move forward because the intent is to match what they have, but it doesn't say anything about taking things off. And I think if there's another piece to this that is needed, there can be another bill, or to the delegate's point, there could be an interpretation by another branch of government around how we deal with that when our state comes to that crossroads.
Okay, Chris?
I think just to add to this and to go back to a previous question, I think, right, Delegate Austin is right about the interpretation. My interpretation, as a Maryland State bill drafter with our style guidelines, is that the bill says any ingredient or additive that is prohibited. So if it is not prohibited at any point by the federal government, then it would not be prohibited here. That's one thing. The second thing is the real thing that this bill does outside of what already is the current situation is that it subjects anybody who violates the section to penalties in Maryland. So Maryland will be receiving money from people who violate the section that they wouldn't already otherwise get, because I guess the federal government has their own penalties, but this provision makes any violator subject to our own penalties, which is a fine not exceeding $10,000 or imprisonment, and then the rest of it.
Okay, all right. I know you want this to move. I want to take it up on Tuesday. I want to look at the amendments. If you want to modify that, that's fine, but I'm gonna hold the bill till Tuesday and we will take the vote that I for one need to think about it and I want to move on. So I apologize for that, but I think we need to have a little bit more clarity. What was said was helpful, but I personally need to process. Okay, let's go on to,
Well, Madam Chair, I have my
Yeah.
hand respectfully.
yes. Go ahead, Delegate.
I
Martinez.
still have a question for council.
Yes, go ahead, Delegate Martinez.
Thank you. Sorry, the Wi-Fi in the building is starting to act up as well. Thank you. My Wi-Fi is acting up because I'm still in the House office building. But my question was regarding the teeth piece. So we really could say that this bill is just adding teeth to the enforcement of these bans for the state of Maryland.
Correct.
Thank you.
All right. So with that clarification, okay, let's go ahead. The amendments have been taken up. Does anyone want to move the bill? Because if we
Move
vote
the
on
bill
it
as
now and it
amended.
doesn't
Move the
win,
bill,
we have to
Second.
bring
move
it
the
back.
bill.
All
Move the
right, so
bill.
it's been moved. All right, all in favor of the bill as amended, indicate by saying yes. Aye.
Aye.
Okay, so Warman, Hutchinson, Riley, Martinez, Kaufman, Austin, and Hill. Okay, there we
Madam
have it.
Chair, my
Riley
hand
was
was not
shaking
up.
her head.
Yeah, my hand was not up.
Oh,
I'm a no
okay, so you're a no. So
Right.
Riley's a no.
at this time, yes.
And I got everybody else is correct. I measured everyone else, right? Okay. Okay. All right. Thank you. Okay, now let's go on to House Bill 1357, Consumer Protection, Menstrual Hygiene Products Labeling Requirements. Chris.
Oh, second.
And I know Delegate Kaiser has an amendment that was recently circulated.
So this bill requires manufacturers of menstrual hygiene products to include a list of ingredients on each package of menstrual hygiene products sold in the state. The manufacturer must list the ingredients in order of predominance and display the list prominently in conspicuous type. Violation of the bill is an unfair, abusive, or deceptive trade practice under the Maryland Consumer Protection Act, subject to the Act's civil and criminal penalty provisions. We did receive an amendment from Delegate Kaiser's office. The amendment defines division as the Division of Consumer Protection of the Office of the Attorney General. The definition of ingredient is changed to ingredient means an added substance in menstrual hygiene product that serves a technical or functional purpose. Menstrual hygiene product has been amended to mean a disposable or reusable product used for the purpose of absorbing menstruation. The bill adds a date for when manufacturers of menstrual hygiene products shall include this list, and the date is on or before April 1st, 2028. It has a few more technical amendments, but another thing to that is a manufacturer may list a proprietary ingredient or combination of ingredients by their common name to protect confidentiality. It also included a provision, a penalty provision. So a manufacturer that violates the section is subject to a civil penalty not exceeding $1,000, and the division shall pay all those penalties to the general fund of the state, with the intent that the penalties be used to fully offset any costs incurred by the enforcement of the section.
Okay. All right. Thank you. Delegate Kaiser.
I'm here on her behalf.
Okay. Yeah, anything to add?
Yeah, so we've been working with the industry reps to, our amendments basically are standardize our language with the other states. Within our amendment request, there were a few things that were left out. So we sent an email to all of you, I believe an hour or so ago, just making you guys aware that we're still waiting on the final version of those amendments. It's a few words missing from some of the definitions and then clarifying that penalty actually matches what we're trying to achieve. But I believe that we are in consensus and I think
I'm sorry, is that an amendment in addition to this, or is it a clarification of the amendment that council just read?
it's a clarification. I believe the amendment office is just going to clean up the original amendment that we had.
Delegate Riley. Well,
Yeah,
let's move the amendment first. And
okay.
then
Well,
we can have
this is kind
discussion.
of on an amendment. I didn't hear this one, so I wanted to ask her if this is one that's coming or if it was something that I just didn't hear Chris say.
No, it's still coming. I think we need to
Okay.
see the final language to make sure it's.
Well, then why
Yeah.
don't we do this? Let's have a
Okay.
little discussion,
Mhm.
3 minutes worth of discussion, and then we'll take the bill up on Tuesday when we
Yep.
have the amendment in front of us.
Sounds good.
Sure.
And I believe Mr. Andy is here to answer any
Okay,
of those
Mr.
specific
Hackman?
questions.
With the amendments as discussed and what's coming, you're good?
Yeah, with the amendment, Madam Chair, members of the committee, Andy Hackman on behalf of the baby and adult hygiene products industry. Yeah, with the amendments that Mega discussed and we worked on with Delegate Kaiser's office, we would be supportive of the bill moving forward.
Okay, Delegate Rowley, you have additional questions?
Yes, I know we received a letter from the Attorney General and something about saying that the bill should add the harmonization clause. So, at the hearing, I don't think Delegate Kaiser agreed to that one. So I just wanted to verify that that's not coming on one of the ones that they were speaking of. And if it's not, can you explain how you feel that it's not needed?
Mega?
Yeah, I'm gonna have to refer back to Delegate Kaiser because I'm not
Okay.
sure we've even seen or received
Okay.
that copy of the letter. I don't know. I don't think that she's opposed to it. We just have not been able to discuss
Okay.
it within
Alright.
this timeline.
Thank you.
Okay, no more discussion? All right, so we're gonna hold this bill hopefully for a vote on Tuesday when we have everything in front of us. Okay, thank you. Let's go on now to House Bill 1523. That's Delegate Ross, Alcohol, Tobacco, and Cannabis Commission, Unauthorized Consumable Products Enforcement and Seizures. And I know there is amendment being worked on. Chris,
It's done.
is it a completed amendment? Can you talk about it, or are we in process?
It's completed.
Okay, all right.
Okay, so the bill authorized the Field Enforcement Division of the ATCC to issue a citation or other charging document to a person who has committed a violation of subtitles 2D, 2E, and 2F of the Health General article. The executive director of ATCC to seize, confiscate, or destroy an unauthorized consumable product that is offered, advertised, or displayed for sale to a consumer in a state as specified, and the district court to impose additional sanctions. The bill prohibits a retailer from distributing, selling, exposing for sale, or advertising for selling an unauthorized consumable product and imposes criminal and civil penalties on violators of specified provisions. The bill also expands the provisions against retailers advertising kratom and phenibut products to minors and requires MDH to notify ATCC of changes in the regulatory status of those products. But we did have an amendment. Really, the essence of the amendment is that let me go to the bill language 1 second. We had this ban on these unauthorized consumable products, and that included kratom, it included phenibut, as well as tianeptine. The amendment removes kratom and phenibut from that new provision about.
I'm sorry, Chris.
But
I think, I think that wasn't, I think the current statute was that, that kratom was restricted and phenibut was restricted by age, and phenibut was actually banned. Is that correct?
Right.
Okay, right. And the amendments take it back to that status.
Correct. But it
Whereas
also
the bill is
includes.
introduced, created a ban on all three products.
Correct.
Okay, so I'm sorry. Now go ahead, because you said we had a ban on all. I just wanted to say we did not have a ban on all.
Well, I'm sorry, the bill is originally written ban all of them, but the amendment reverts it back, like you said, to what the current law is. It also goes into the current law about kratom and the restrictions on kratom and phenibut, and clarifies that the ATCC, in conjunction with the department, have concurrent jurisdiction to enforce the section. And it also just has a few clarifying amendments.
Okay. Delegate Ross, are you able to, anything you want to add?
No, I missed a little bit of that. Now my audio just went out for me. But no, I think that all sounds fine.
So it's, in essence, the bill takes explain what it does, the status quo, and it adds enforcement.
It adds that the department and the ATCC have concurrent jurisdiction to
Okay.
enforce the restrictions on Kratom and Phenibut.
Okay, so Delegate Ross, it does not change our current statute about what's banned and what's restricted.
Perfect. Yeah,
It
that
just-
sounds great.
Okay, all right. Can we move the amendments and we can have a discussion?
I'd like to move the amendments.
You can't, because
Oh, that's right. I keep thinking I'm in my committee. It's you all are family. I keep forgetting I'm not actually
Move the
managing.
amendment.
Delegate, all right, so Kaufman has moved and Austin has moved, so that makes a move in a second. Okay. Any discussion on the amendments? All right, all in favor of the amendments indicate by saying aye or raising your hands. So I've got Warman, Hutchinson, Riley, Martinez. Austin, are you not voting on the amendment? Yes. Kaufman said yes, and Hill. Okay. Can I have a Hutchinson, is your hand lingering or, okay.
It's
All
on
right,
the, on
can
the
we get
bill.
a motion on the bill as amended?
Move the bill.
Thank you. Second.
Second.
Thank you. Okay, any discussion? Delegate Hutchinson, you wanted to ask something about a bill?
Yeah, thanks, Madam Chair. And I guess Delegate Ross, we had that short conversation after the hearing the other day. And
Yes.
if I sum this up correctly, we're not banning anything. What we're trying to do is, I guess, to enforce what we currently have in statute concerning these products. Is that sort of the gist of this bill?
That's exactly the gist of the bill. In fact, that's the total beginning to the end, soup to nuts. I mean, that's all this bill is about. And I know
And why, again, like, so we have it in statute. So why, again, are we creating a statute to enforce a statute?
the original statute did not include this enforcement authority with the ATCC. So this is specifically to do that.
And if I recall, the ATCC is fine with taking on this enforcement responsibility.
They are, yeah. They have no capacity or bandwidth issues. They are completely resourced to do it. For them, it's just almost like another item on the checklist.
Yeah, thank you so much. Thank you, Madam Chair.
Okay, all right. Delegate Riley?
Yeah, thank you, Madam Chair. Sorry, I have so many questions this time around. So I agree with the enforcement. I think it's very well needed, and ATCC is a great department to do it. I just wanted to verify, so the authority that they have now, they're going into like the gas stations and all the places where this product is being sold, that's causing all the issues, but they're not going to go into the establishments that actually sell the powder. They're actually giving it for healthcare reasons. Is that true? Is there a distinction, or are they
Right.
going both? Okay.
We talked about this a little bit with
Delegate Ross, we don't
agent.
have but a few more minutes, so go ahead and summarize what you're saying. Sorry.
Right. Sorry. Thank you, Madam Chair. Basically, their enforcement authority does have some parameters, and I can get some detail about beyond these substances, get details on how and where they can conduct that enforcement, because it's not. I know that the focus of this is obviously for the bad actors, the nefarious, businesses, or I'm sorry, people who are not in compliance with the original statute. But yes, they do have some broader enforcement authority that may permit them, Delegate Riley, to be in some of those other spaces. So in truth, I really should confirm with the agent, just where does their enforcement authority beyond these substances, where does that end? Can they go into some of those other settings and conduct inspections? So I'd have to get back to you unfortunately on that.
Yeah, I do appreciate that. So I don't want to, stop your bill. So I'll just let Madam Chair know that I'll just abstain until I can get that information and, and possibly vote by the time we get to full committee.
Okay.
Great.
Thanks.
Fair enough.
All right. Chris, go ahead, please.
Thank you, Madam Chair. I just wanted to clarify something that for Delegate Hutchinson if he needed it. It does include a ban, and the new language is now only limited to tianeptine, which has not been approved by the FDA for medical use, and it's illegal for sale by the FDA. So we're putting it in Maryland statute and giving the ATC the authority to confiscate it. But we
thought TN
removed kratom and phenibut from that ban and just reinforced what we already have in law for the restrictions for those two things.
Oh, okay. I thought that
Thank you.
then we had banned that in the 2025 bill, but I say corrected.
Right. In the consumer protection bill, it's not banned. Kratom and phenibut are not banned, but they're
I'm talking about
regulated.
the other one, Tinabid.
Yeah, Neptune, yes, that is banned in the prior bill.
Right. Okay. Okay. All right. So we moved the amendments and the amendments were taken up, right? And then the bill's been moved, so we're on the bill now. Okay. And Delegate Rowley has said that she's going to be abstaining. And can we have a show of hands for all in favor of the bill as amended?
Aye.
Okay. Kaufman, Warman, Hill, Austin, Martinez. Okay. And Delegate Hutchinson, are you a no or are you abstaining? You're muted.
I'll abstain until I get the answers
Okay,
to the same
so we got
question.
two
Thank you.
abstentions. Okay, very good. Okay, and then, so the bill passes, and let's go now, and I went out of order. I'm sorry, I apologize. Tierra's Law, House Bill 1485. Sorry for going out of order.
Madam Chair, if it's okay, I'm gonna pop off and join another call.
Yep, thank you.
Thank you.
Great weekend.
You too.
This bill requires the Maryland Department of Health to develop a pamphlet to inform the public about the crisis response system, the state and national 988 suicide and crisis lifelines, and programs provided by the 988 suicide and crisis lifeline. A healthcare provider or representative of the Office of the Chief Medical Examiner must provide the pamphlet to an individual on request or when reasonably appropriate in connection with a death, an overdose, or a behavioral health crisis response. MDH must conduct a review of any trauma-informed care training that is provided to healthcare providers, including training regarding family engagement and post-incident support following overdoses or behavioral health crises. By December 1st of this year, MDH must report to the General Assembly on its findings and recommendations. The bill takes effect July 1st.
Okay.
And there were no amendments.
There were no amendments. Okay, is anyone here to speak for the sponsor who is the speaker? Anyone move the bill?
Move the bill.
Okay, any
Second.
second? Any discussion from the members? No questions? We have people here. Okay, let's take a vote on the bill. All in favor, say aye and raise your hand.
Aye.
Okay, Warman, Hutchinson, Riley, are you voting? Yes, and then Martinez, yes. Austin, yes. Kaufman, yes. Hill, yes. Okay, it passes unanimously. Thank you, and thank you for the advocates who are on the call. Thank you for being here for questions. Okay,
And Delegate Hill,
yes.
if we could, the subject of the bill's mother is in the room with us, and just wanted to thank her for bringing the bill as well.
We want to thank you, Ms. Scott, for bringing the bill. And if you have.
Thank you very much.
Okay.
Thank you very much to all of you. Let's work together to serve the families.
All right, thank you so much. And thank you for staying with us for the subcommittee meeting. Okay, last bill on our list, 1264, which may have a sponsor problem. So it's Maryland Medical Assistance Program Tobacco Cessation, Delegate Hill. Chris, can you speak to this bill, please?
Yes, 1 second. Did you receive a fiscal note for this bill, Delegate Hill?
Now you gotta make me look some stuff up here. 1264.
I found it online, it's fine.
Found it, right? It's there. Yeah, we
This
have
bill-
one. We have one for the bill hearing. Yeah.
The bill requires Medicaid, subject to the limitations of the budget as permitted by federal law, to provide individual and group counseling for the purpose of tobacco cessation. Medicaid and a managed care organization may not require prior authorization for any product or service for use in eliminating an individual's dependence on tobacco. There was an amendment offered by you, Madam Chair, to include counseling provided by telephone and to say that a program and managed care organization may not require prior authorization for any product that is approved by the FDA.
Okay, all right, so I'm gonna move the amendments, and then if I get a second, we'll open up for discussion. Okay.
Second.
Move the
All right,
amendments.
Thank you. Okay. All right, questions on the amendments? Okay, then let's take a vote on the amendments. All in favor, raise your hand or signify by saying aye. So Warman's a yes on the amendments. Martinez is a yes. Riley's a yes on the amendments. Hutchinson, Austin, Kaufman, is that a yes?
Yes.
Okay, all right, so the amendments pass. Now can I get a motion on the bill and a second so we can open it for discussion?
Move the bill as amended.
Thank you. Any second?
Second.
Thank you. Okay, discussion on the bill. Any questions, any concerns? Delegate Riley, yes.
Yeah, so according to the fiscal note, there's going to be quite a bit of money that's going to be needed to do this. Now I understand what 60% federal funds it says, 40% general fund, but that is like 258,000 for additional tobacco. So is this and 1.2 million additional tobacco? So where is this coming from?
Okay, so let me point out that here's the issue with the fiscal note. So the fiscal note starts off by saying we don't know how many people will take advantage of this, and that actually there is already coverage for counseling for these drugs and smoking cessation generally made. So the assumption is that by allowing these services to also be covered in federally qualified healthcare centers, and under so let me back up. So the smoking cessation services are delivered by a primary care provider, including services I'm actually reading from the fiscal note furnished in a federally qualified healthcare center, are subject to MCO utilization management requirements, okay, which could include prior authorization. So essentially what this bill does is it lifts that piece from it. So they're now speculating as to how many people may take advantage. What we are doing is we are providing, and it was asked for during the hearing, you had testimony that the savings in terms of disease prevention, both non-terminal diseases like COPD, asthma, and cardiovascular diseases, and terminal diseases like cardiovascular disease and cancers. We're preventing those from occurring so that if we had a dynamic evaluation, we would be able to see the savings there. And the fiscal note says the Department of Legislative Service notes that increased utilization of these services and medications is likely to lead to a reduction in dependence on tobacco and result in associated long-term savings. So we are, and we'll have for the members of the subcommittee, the members of the committee, we will have those numbers so that before we take a final vote, you can see what those projections look like. But I think intuitively, all of us know that in addition to being good for people to not end up with cancer and cardiovascular disease and all those things, that preventing those things is what healthcare is all about. That we know intuitively that the healthcare dollars of not having to treat someone with cancer, cardiovascular disease, amputations, and all of those things are savings, but we want to give you some numbers to look at. Does that make sense?
Yeah, I mean, I definitely agree. I mean, a lot of our fiscal notes, they are very frustrating because they don't take in consideration the health benefits that it brings, and then, comparing the savings that it's going to cost from health by, by prevention, basically.
Right.
But right now it is considered Medicaid expansion in the fiscal note.
I don't think it's
So
considered medicated. Well, okay, yes. Let's
yeah,
go for the sake of argument. Yeah.
Medicaid expansion.
Mhm.
Yeah. So, and where are you getting those figures from, you said, to give us?
Yeah, so we're asking MDH to give us
Okay.
the number, how much they spend on those services.
Okay.
And then we have some other statistical information as well.
That may help. All right. Well,
Okay.
again, then I'll have to sustain if you go for a vote, and then wait until I get the information.
Okay, any other discussion? And let me just also note in the bill, and this may give you some comfort, if you look in the bill on page 2, the way it is written, it says shall provide, subject to the limitations of the state budget.
Okay.
And as permitted by federal law, individual and group counseling and counseling provided by telephone.
Okay. And you also included in that, which was good, where, subject to federal law agreement as well. Okay. All
Okay,
right. I
so
do like that.
so within state budget was meant to couch that.
Right. Okay.
All right, and to give some flexibility, but the goal here is to make sure that people who need the services to quit are getting the services they need to quit.
Right. I definitely agree with the goal, Mr.
I know you
Chair,
do, but and again, that within state budget is similar to language was used in other bills where budgetarily permitted, et cetera. So that's that same language.
Gotcha. All right. Thank you so much. Appreciate it.
All right. Thank you, Delegate Hutchinson.
It's somewhat of the same vein, but just a clarification. You said you'd get that data for us before we voted. Are you referred to vote in sub, full committee, or?
I'd like to vote in sub, and then we can always hold it in full committee if people need that for the votes. But there's not debate and disagreement about what we're trying to do. And as I said, I think intuitively we all know that the goal of healthcare is to save lives and to minimize disease. And we understand for 2 generations that smoking cessation does that what we're talking about is some kind of tangible evidence, not to change our minds about whether it's beneficial, but that we can show that it's beneficial. That's why I'd like to move the bill, because I don't think it's about giving you something to prove what you already know. It's about giving you something that you can show. Does that make sense? That's why I'm seeing that as different.
It does. And I think I will vote favorably now. I could change my mind once that data, or if that data doesn't produce itself. In theory, I think we all know what the positive outcome would be of stopping smoking.
All right, then let's go. We voted on the amendments. Now let's vote on the bill.
Move the bill.
Move the bill. Thank you. And it's been seconded already. Can we, all in favor of the bill as amended, please raise your hands or indicate by saying aye. Delegate Warman, Delegate Hutchinson, Delegate Martinez, Delegate Austin, and Delegate Kaufman, and Delegate Riley is an abstained or no?
Sorry, abstain.
All right, thank you very much. And with that, thank you for working with us. And we started at 1:46 and we finished at 2:42. So thank you and have a great weekend. Thank everyone else.